With over 400 million hashtags on TikTok, it is no surprise that you've probably heard about the lip flip. In today's episode of Dr. Nora, I take you through everything you need to know about this procedure, what it is, and what results you can expect from it. Loads of celebrities have claimed that they've had their lip flip and they've made their lips look bigger and fuller with just some minimally invasive injections. But what actually is the lip flip and why is it performed? Well, the lip flip is a minimally invasive procedure that uses anti-wrinkle injections, yes, that's right, the ones that we use for a frown and our forehead, into the upper aspect of the lip. And the idea is that it helps to subtly evert the upper lip. Now, this helps to create a fuller and larger looking lip without having lip filler. But Dr. Nora, what are we actually injecting? Well, obviously, your cosmetic practitioner will be doing this themselves, but a little bit of knowledge for you guys out there. We've got a diagram of our facial anatomy here. Now, you can see there's loads and loads and loads of muscles, but what we're going to look at over here is the muscles around the lips. Now, this is a concentric muscle, goes around the lips, and it's called the orbicularis oris. The objective of this muscle is obviously to move our lips so that we can communicate with one another. And you can see that right now I'm using my muscle to communicate with you guys as I'm talking. Now, the idea of the lip flip is that we inject the upper part of this muscle, and we do this by going a few millimeters above the border of the lip, otherwise known as the vermilion border, and we do a few injection points either side of the philtrum columns. Now, the philtrum columns are those two little lines that go from your nose into your upper lip. Why are these so important? Well, these actually help to give our lips lots of structure and support. If we obliterate those philtrum columns by means of using anti-wrinkle injections, we actually then lose that V shape, that very beautiful Cupid's bow that we tend to have. So it's a big no-no to inject into these lines. And generally speaking, when we are doing injections, we will use some tiny, teeny weeny needles like so, as you can see, and we will inject either side of the philtrum columns. Now, of course, as with any procedure, this one does carry its risks, and the risks are as follows. Now, with any injection, there will certainly be maybe some bleeding, some bruising, and some inflammation. The other risks that are associated with this procedure is that if you, for example, don't follow your aftercare instructions and you rub your face or you have a sleep on your face, you might actually spread the product to a different area. And so this causes undesirable effects for your lips, and that may actually affect your smile or affect the way that you move your lips as well. One of the other negatives to this procedure is that you'll find that it's much harder to whistle or perhaps sip on a champagne flute because we're getting rid of that beautiful pursing action of that muscle. This is only temporary, so do not be alarmed. You will get the full movement of your lips very soon after injections. Now, of course, as with any anti-wrinkle injection, it does take about 2 weeks for it to start working, and you'll only really start seeing some changes within the first 3 to 5 days. And generally speaking, it should last up to 3 to 5 months in total. Okay, so we know about what the lip flip is and how it's performed, but who is it actually suitable for? Well, this is actually really important because it's not suitable for everybody and it doesn't work for everyone. And it's really important that if you are considering your own lip flip, that you go and speak to your own medical practitioner for your own individual advice. However, broadly speaking, those people that will benefit from the lip flip would be those, for example, who have a thin upper lip and they want to try and evert that upper lip. Because remember, the lip flip will evert the upper lip and help it to look more fuller and larger. It's also useful for people who perhaps have more of a gummy smile, because once we have the lip flip, it actually reduces the gummy smile appearance.
And let's take a look at one particular example of mine. So this is a lovely lady of mine who had the gummy smile, and as you can see, when we injected a little bit of anti-wrinkle on each of those nasal flares, it helped to reduce the appearance of this gummy over here. You can see over here, this gum is really quite prominent, to this side over here, making it a lot less apparent.
Now, of course, you can check out my video in the link in the description below of how we specifically treat the gummy smile. However, the lip flip may also help with this as well. It's also useful for patients who want a subtle result. Now, I have to really underscore this a million times over because you will not get a humongous lip with a lip flip. Lip flips are generally just really subtle results. And you can see here from before and after that this person just liked that subtleness. If you are looking for something a little bit more larger, then perhaps a lip filler is more suitable for you. More on this in a little bit. Now, interestingly, it is not just the lip flip that we can create by injecting these areas over above the lip. Have you ever seen anybody who has got smoker's lines or Barco's lines? What do I mean by that? Well, for those of you out there who do know what I'm talking about, well done to you. Round of applause. Smoker's lines or vertical lines are vertical lines that go from above our lip into the fleshy part between our nose and our lip. Now, generally, this tends to be more accentuated in those people who are smoking because they're always pursing their lip. And of course, as we all know, if you're always using a muscle, you'll eventually have what we call dynamic lines and then leading on to static lines. And those are lines that are there without any expression. And so typically we tend to see these vertical lines, people who smoke, or even people who lose their fat pads in this area, which happens to us as we get older with time. And typically the person will present to me saying, you know what, doc, I love my lips, but whenever I put my lipstick on, it just bleeds through my upper lip because they don't have that definition. And so we can actually use the lip flip technique or anti-wrinkle injections into the same muscle, the orbicularis oris, around the top of the lip to smoothen out those lines and actually help that person not to have any lipstick bleeding. Now, for some people, this is an absolute game changer. They don't need to have lip filler. They don't need to worry about doing anything more invasive. It really just takes a couple of injections and hey presto, they can use their lipstick without any embarrassment at all. So not only is the lip flip helpful to increase the upper lip size very subtly, but it also helps to reduce those vertical lines that happens as we age or if we're smoking. Wow, that sounds great. So what about lip fillers? Could I also get lip fillers done as well? Well, you'll see on my channel that there are loads of videos on lip fillers and exactly what they do to the lips and what results you can expect. The difference between lip filler and a lip flip is purely the product that we're using. So for example, with the lip flip, we're using an anti-wrinkle injection, whereas with the lip filler, we're using a dermal filler. This means it's comprised of hyaluronic acid, so it's much thicker in its viscosity. Now we're injecting the lip filler into the lips rather than above the lip area. And the idea of a lip filler is to increase the volume and change the shape of the lip itself. You will get much more of a volume change with a lip filler than you will with a lip flip. So it's really important to understand the difference between the two and to know exactly what you're going in for. And generally speaking, lip fillers tend to be more expensive than a lip flip. So if you're thinking that you might be getting lip filler, say for a fraction of the price as you normally would, have a chat with that person because it may be that you're actually having a lip flip rather than lip filler. And as we know from previous videos, we know that lip fillers are slightly more invasive. They produce a little bit more side effects. For example, there's more swelling, there's more bruising, there's more inflammation, and generally you tend to have big lips for a few days and then it all settles down after about 3 to 5 days. But the result of your lip filler will look amazing after 2 weeks and it will last you generally longer than your anti-wrinkle injection to the upper lip. It will last you about 6 to 9 months in total. Now you may be thinking, well, could I use both? Can I use lip filler and can I use a lip flip? Well, you certainly can. Now this is often something that we do very commonly in practice. In fact, I do it for a lot of my patients because they want to have their beautiful lips filled up, but they also may have, for example, those smoker's lines or those vertical lines above their upper lip. Now, one thing to note is that when you do have lip filler into the upper lip, it will actually smooth those lines out by itself, but it won't do as good a result as if you were to have anti-wrinkle injections. So typically we tend to use both in combination. But we can also use fillers and the lip flip together to help to create a more everted upper lip so that the lip looks fuller and larger. Of course, remember that the anti-wrinkle side of this will only last you about, say, 3 to 5 months, whereas the filler will last you anywhere up to 6 to 9 months in total. So there you have it. That is the lip flip, what it is, who it's most suitable for, and how it's performed. Remember, guys, if you are considering any of these procedures, be sure to speak to an adequately qualified cosmetic practitioner for your own individual treatment. I hope you guys have found this video useful, and of course, if you have any questions or comments, please don't hesitate to drop me a line in the comment section below, and I'll see you on the next one. Take care and stay healthy.